Hey everyone, welcome back to my channel. I'm Nurse Miriam and I'm here to help you conquer the NCLEX. When preparing for the NCLEX, the gastrointestinal system can feel like a beast, but it doesn't have to be. There's so much to know, right? Don't worry, we've got this. In this high yield review, we'll break down some of the most commonly tested GI conditions on the NCLEX. GI bleeding, ulcers, pancreatitis, and hepatic encephalopathy. We'll focus on what you really need to know to pass. No fluff, just facts. Let's dive in. Alright, let's talk about GI bleeds. This can be really scary for patients, and the NCLEX wants to make sure you know what to do. Now, GI bleeds can be upper or lower, and it's important to know the difference. Upper GI bleeds often present with hematemesis, which is vomiting blood, and it can look like bright red blood, or coffee ground emesis, which is darker and thicker. This happens because the blood has been partially digested. Melena is another sign, and that's black tarry stools, which indicates bleeding higher up in the GI tract. Lower GI bleeds, on the other hand, usually present with hematochezia, which is bright red blood in the stool, indicating bleeding closer to the rectum. Now, no matter where the bleed is, your priority is always going to be your patient's ABCs, airway, breathing, and circulation. You need to make sure they're stable. So you'll monitor their vital signs closely, watching for things like hypotension, tachycardia, and decreased level of consciousness. These could all be signs of hypovolemic shock, which can be life-threatening. You'll also want to establish 2 large bore IV lines for fluid resuscitation and potential blood transfusions. Remember, the name of the game is to stabilize your patient first. Let's move on to ulcers. Peptic ulcers are like little sores that develop in the lining of the stomach or duodenum. Think of them as open wounds in your stomach or intestines. Ouch, right? Now, the most common cause of ulcers is this bacteria called H. pylori. It's actually pretty common, but in some people it can cause ulcers. Other risk factors include NSAID overuse. Those are your ibuprofen and naproxen, smoking, and alcohol use. Now, when we're talking about ulcers, there are 2 major complications we need to be on the lookout for: bleeding and perforation. Bleeding, as we talked about earlier, can be a big deal. Perforation is even more serious because that's when the ulcer actually creates a hole in the stomach or duodenum, and that's a surgical emergency. So what are we looking for? Patients with ulcers usually complain of burning pain in their upper abdomen, and it might be worse at night or on an empty stomach. They might also have nausea, vomiting, or feel bloated. Now, if a patient with a known ulcer suddenly develops severe abdominal pain and their abdomen becomes rigid, that's a huge red flag for perforation, and you need to call the doctor right away. Chapter 3, Pancreatitis, when your pancreas fights back. Now let's talk about the pancreas. You know, that organ that's kind of tucked away behind your stomach. When it gets inflamed, it's called pancreatitis. Imagine your pancreas is like a factory producing enzymes to digest food. In pancreatitis, enzymes start digesting the pancreas itself. Ouch! Common causes are gallstones and alcohol abuse. Gallstones block the duct, and alcohol irritates the pancreas. Patients usually have severe upper abdominal pain, often radiating to their back, Lab tests show elevated amylase and lipase levels. Chapter 4. Hepatic encephalopathy. When the liver impacts the brain. Last but not least, let's talk about hepatic encephalopathy. This one's a little more complex, but stick with me. So our liver is like a giant filter that cleans our blood, right? But when the liver is damaged, like in cirrhosis, it can't filter out toxins as well. One of those toxins is ammonia, and when ammonia builds up in the bloodstream, it can affect the brain, leading to hepatic encephalopathy. It's like the ammonia clouds their brain function. Early signs of hepatic encephalopathy can be subtle, like changes in personality, confusion, or forgetfulness. As it progresses, patients might have trouble concentrating, slur their speech, or even have tremors called asterixis. In severe cases, they can become completely unresponsive and slip into a coma. One of the ways we manage hepatic encephalopathy is with a medication called lactulose. Lactulose helps to trap ammonia in the gut, so it can be eliminated from the body. We want to make sure patients are having regular bowel movements, ideally 2 to 3 soft stools per day to get rid of that ammonia. Outro, you've got this, future nurses. Wow, we covered a lot today. We talked about GI bleeds, ulcers, pancreatitis, and hepatic encephalopathy. Remember, the key to mastering GI for the NCLEX is to understand the why behind the what. Don't just memorize facts, make connections. Think about the pathophysiology, the signs and symptoms, the potential complications, and most importantly, the priority nursing interventions. Your goal on the NCLEX is to provide safe and effective nursing care, so put on your nursing brain and think critically. Please subscribe to our channel for more NCLEX tips. Download your free copy of the Ultimate NCLEX Guide from nursecareerblueprint.com